Hi everyone, I'm Dr. Mindy Goldman. I'm the Chief Clinical Officer at Midi Health. And today I wanted to talk to you a little bit about testosterone pellets because we see a number of our patients coming to us asking us if we will refer them for pellet placement. So the important thing to realize is if you are on pellets and you like them, you're doing great, that's great. We certainly won't recommend you stopping them. But at Midi, we tend not to refer people for pellets for a number of reasons. One is they're expensive. It's also a surgical procedure to place them. It's minor, but it's still a surgical procedure. One of the biggest reasons is that you can't adjust the levels. When we use testosterone in other ways, like a compounded cream, we can adjust the dosing pretty easily. But with a pellet, you can't adjust the levels. And sometimes those levels also get super high. They get super physiologic. And that can even affect the testosterone receptor where it stops being as sensitive to the testosterone because of constant exposure to that high level. And then another reason is sometimes these are placed at aesthetic centers where they don't have an HRT trained provider on site. So for all of these reasons, we tend not to prescribe or recommend the pellets. Again, if you're on them, you're happy with them, that's great. The important thing is when you come to see your Midi clinician, they're going to help you come up with whatever treatment is right for you.